one of the reasons why we wanted to have you guys come on this call is because this story is very powerful. Because what it shows is it shows the collective power. When you ran into a situation with the department and some of the proposed changes that they wanted to make, they didn't follow the procedures that are laid out as a provisions in our contract that say, okay, we're going to do a meet and confer. They offered up a duty statement with changes in it. And, we were made aware of this, and it was obvious from just your story. What I've been told is that you're all sort of taken aback to say that we're in the midst of a pandemic. So before we get into those proposed changes, what I really want to hear about is I want to hear about what caused you all to organize? What caused you all to come together in the way that you did?
You mean the shoe period? So basically, in 2015, we had just gotten done bargaining the 2016 contract, and we had no mention in it. The only thing that mentioned happened were a stipend that we would get if we spend 10 days in LA, and that was. The rest of it was obsolete. So I asked our bargaining unit chair why that happened, and it was told to us, I only know of 2 of you all statewide that's a HFEN. We don't know what you do. You're never at, and it was like so offensive. I was like taken back, like, you'll never be able to say that to me again, because we are gonna, and it's not like the union had a blueprint for us. The union did not have a blueprint for us, and did not give us emails, did not link us, district offices. It was grassroots. You see in a training, you may see, oh, you're helping from San Francisco, we get together. And so the rest is history. Mary Dela Cruz and myself, a few others joined in. Elsa Monroe was very influential in helping us in that. And so, the rest is history. And now we have Ventura, Orange County, San Diego, LA Monitoring Unit, State Facility Section, San Jose, San Francisco, East Bay, Bakersfield, all, these offices now coming together collectively. And the power of unifying is just immense.
Well, and that's the part that I think people need to understand is that, again, there was something that basically drove you guys to connect with each other, to say, we have shared experience here. We're all, underneath the same department, and we have an issue. And so you guys came together in that way. And it certainly caught the attention of, some of us, at SEIU, Local 1000, to say, okay, we've got this group of nurses that have some concerns. And so talk a little bit about that, and anyone feel free to jump in on that.
Are you saying the concerns more contemporaneously or back then?
Just in terms of where you are today and how we've got here. I'm trying to kind of lay that out. So
we definitely had concerns. We as health facility evaluator nurses are, of course, our salary, we all are talking about money. Our salary is not commensurate with the public sector, our other public health nurses. Even our county counterparts make a couple thousand a month more than us. So in bargaining, we were really dependent on our bargaining team to bargain a robust package for us. Last year, we started asking our deputy director way before bargaining in April of last year to reclassify us, because the last time our series had been reclassified was back in 1989. And so it's been 3 decades that no one's paid us any attention, not bargaining, salary, anything like that. And that's horrible. And so in the midst of a pandemic, bringing it more to now, you're being asked to do more for less. Besides, we, as you know it, being the vice president of bargaining, and the result of the side letter, the governor asked us to help eradicate a $54 billion with a B, $billion deficit for the state of California. That being in the midst of doing less. So the reason we came together was for this. So our deputy director took a proposal to HRB, who's now escalated it to CalHR, and we're hoping CalHR and SEIU don't wait until the next bargaining session, because they deemed us essential and we are front line of this pandemic. So I would hope they are paying attention to, we're doing mitigation, we're doing contact tracing, we're doing infection control surveys. Pinky on the line, she helps with, she can tell you what she does with HAI, and it just, so now us coming together, we can kind of see what we all do, how we can help each other, not just in organizing, but even representation. If somebody could call you, and right now you can push a button and have 50 nurses on the phone helping this person with the representation matter and endorsing their letter to management or whatever, it's powerful that we pull together like that. We're family.
Okay, can we talk a little bit more? I really want to explain more for the people about what it is that the department had proposed in those changes, because you talked about a brand new duty statement, right, that was put out. Let's hear a little bit more about why that's an issue, the new duty statement.
One of the things that I saw within what they were doing, they were making radical changes really fast. And a lot of the changes were actually reclassifying us as opposed to what our original human resources classification was, what we were hired on. Say that classification may have consisted, excuse me, of A through F, and they made it A through Z now, was included in that classification. So our salary was cut by 10%. And then we had quadruple duties then added into our classification. And in that classification, there were duties in there that contained a conflict of interest. One of the oaths that we take with the nursing board when we graduate is the Hippocratic Oath. Mm-hmm. And that we are to stay on top of things as far as if we have a conflict of interest in something, that we are to address that. We can address it with the board, or we can address it in other ways. Part of what I saw within the radical changes were the violation of 3 laws. And those laws were the laws that we were to regulate as HFENs, as enforcers of quality care. The one law that we violated was Health and Safety Code 1417.3. And in the Health and Safety Code, it stated that we are not at any time to be advisors and enforcers at the same time, that would be a conflict of interest and an unethical, illegal behavior. Another law that we were violating was the 1987 Nursing Home Reform Act. And in that Nursing Home Reform Act, this had all been tried. What we were being asked to do was already tasked to do in 1987. And Congress had investigated this and found out that this was a complete catastrophe, that the quality of care had plummeted severely based upon the surveyors being both advisors and also enforcers, because that put the surveyor in a conflict of interest role. And when we were doing surveys before COVID, we were in these facilities as solely enforcers.
Right.
In an enforcement role, the facilities have a boundary with you, okay? And that boundary is, here comes a surveyor, we need to be on our game, we need to provide quality care. And what was happening is that as the surveyors were supposed to go in and be guidance counselors, more of a guidance counselor, going in and saying, oh, you didn't do this correctly and you need to do this. And so now we're giving advice, we're becoming educators, we're becoming advisors. So now we're becoming more friendly, we're fraternizing, all things that we were told, you can't even take a glass of water from the administrators in these facilities, because that would be considered a conflict of interest.
Like a gift, right?
Exactly, exactly. And so now we're coming in and we're muddying the waters. we're enmeshed with them in a way where we used to be in a clear boundary situation.
Right.
Now we're enmeshed. And so in that enmeshment was the same situation that was going on in 1987 with the Nursing Home Reform Act. The reason why that act was reformed was because they were having difficulty with the quality of care in the facilities and found that the quality of care in those facilities went way down because of this. So they enacted this law to say this will never occur again.
Right.
So here we are in 2020, and we are approaching to do this again the second time around when it's already failed, and there was a law passed to prevent this from ever happening again. So according to the Nurse Practice Act, then here comes the ethical dilemma. What are we doing in this position? We're supposed to be enforcers, and now we're going in and we're supposed to be educators. I've had situations happen to me going into these facilities where I've actually had administrators or director of nurses say, oh, do we get another freebie this time?
Right.
A freebie meaning, are you coming here to help us, or are we going to be cited this time?
Mm.
So this really set up a dynamic that was really difficult to straddle the line and to maintain your respect as an enforcer, and to go in and really try to hold the line and make them accountable for what was happening in these facilities.
Now these facilities do have, there is someone that already does fulfill that role, the role of the educators that would go in and work with operators and whatnot. Is there already a group that does that?
Yes.
Yeah.
And there's also the facilities, they have their own. They can hire their own consultants, and these facilities are not poor facilities. They're run by corporations that are for profit. And the problem with having us go in there and take over the role that they would hire a consultant for is that we no longer are the enforcers anymore. We're holding their hand, and then the enforcement part of it gets put to the back seat. That means in the midst of a pandemic where we have vulnerable populations like in convalescent homes, where we're the only people that they have that are their advocates to go in there to make sure they're not abused, make sure they're not mistreated, make sure the facility does what they're supposed to. Our role has been totally changed into a role that fits more alongside helping these facilities make it through the pandemic and not doing our job, which is to ensure that people are taken care of, that we enforce the laws. In 1987, they discovered that the problem is that if you try and work as a surveyor and a consultant, you don't do the enforcement. These are facilities are owned by these big corporations that have the capacity to have their own infection control experts. And at times I've seen them when I've gone into convalescent homes. They get them, if we do a survey, they're right on the spot. And the issue we have now is not only are we're enforcing less in the midst of a pandemic when people's lives depend on it, but we're also doing it in a capacity where I'll be the first one to say, I've had 30 hours of specialty infection control encompassed for COVID. I'm not an infection control consultant. I'm a registered nurse with some infection control background, but that's not my role. And with that is, A, it puts these people more at risk because I'm A, not an expert, and B, our job is to make sure we do our job that we're trained for, that we have the background, because now the vital time to be doing that.
Yes, I totally agree that. I totally agree with that. That's why right now on what I'm doing or my position right now, I can see both, and I can see the disadvantage of doing it together.
Right.
Especially
We,
because they use that. They use that. If you go in there and you say something, we go in after they say, well, the HAI person said it's fine. And it becomes a scapegoat system. And that's what's happening because I've already seen it in our office and it will continue to happen because it gives the facilities a scapegoat for not doing what they should be doing. And because we're the only ones that are able to go in these facilities, families, friends, loved ones can't even see them. It's all the more reason there needs to be enforcement that we need to make sure
That's
they
a,
do what they're supposed to be
yes,
doing.
yeah. There's
Now's the
no
time.
really way that they can mix it together. It's either or. They cannot put like HFEN to do both duties because it's absolutely not going to give the facility an advantage.
What do you know? Let me ask this. What do you know about the decision making that went into these proposed changes? Because, I mean, it sounds like, you're being asked to do something that is questionable, to say the least, in terms of just the ethics of it. So I'm curious to know what went into that decision making, because you would think that, they would have consulted with you all because, this is the work that you do.
It should have been. It should have been.
let me see if Darren, were you going to say something?
Well, I just said they didn't consult us, to my knowledge. I would say zero. And the thing is, when there's a major incident where, say, a facility has a high death count and there's press about it, the facility, they're not going to take the heat. They're going to turn it back on CDPH and say that the consultant told them X, Y, Z.
Exactly.
Yeah,
That's what
it's
Linda was
more,
saying, that the liability is the,
it's us.
and the answer to Tony's question, it's gone through 4 revisions already.
Yes,
It was very flawed. So
yes.
we're at the 4th revision of the duty statement, which means they changed it. They took consultant out, but now advising
The
is in
word.
and
Because
they're
of the
playing semantics. They took out liaison at one time and put you'll be the point person. Because at one time they were telling us we're going to go in, help with managing the SNF, going to do
Yes.
testing the patients or testing the staff or whatever. We were going to do it. It was just up in the air. It's just been, apples and oranges. 4 revisions of a duty statement, and we haven't gotten to the survey process has been changed 4 times. It was called an adopt a SNF, then it was called the QSO, it was called and now it's QSS, it's Quality and Safety State SNF Survey. And in this particular current proposal, they would like to also change our name along with that proposal. With that proposal, they don't want to call us L&C surveyors anymore. They want to call us Quality and Safety Surveyors, which anytime quality or safety is behind your name as an RN, you should be, making a lucrative salary because you're dealing with liability like quality management.
What are those? What are those discussions like with the department? How is that proceeding now?
So before we get to that, real quick to pick up on what Ron was saying. So when you use the word quality and safety, those are names that are implemented or used within a facility that they're working under risk management because they want to mitigate risk. So they use quality and safety to try to make improvements within so that their risk level goes down. That's not our job. Is to help the facility mitigate their own risk. We go in to enforce the regulations.
Exactly.
And the
Thing that's important
issue with this problem is in the midst of a pandemic, in the midst of a pandemic when it's so important because we're the only people that are able to go into these facilities to make sure your grandma, your grandpa, your uncle, your wife, your husband are okay because they're dying in there. We're the only ones that are allowed in there. And 4 different times, our roles been changed and changed in ways that are not our duties, that we're not fully qualified to do, and in ways that we don't feel comfortable without PPE and without the proper equipment to be able to do it.
So what are those discussions like with CDPH? I mean, as you guys voice these concerns and you kind of meet with the leadership there, how is that going today?
I don't know about anybody else, but I know that in my office, a lot of my coworkers, they continue to do the surveys, they continue to do the work.
Mm.
People are frustrated. It's very difficult because, I mean, as nurses, we have a heart for the work we do. We, you
Right.
know, we're nurses. That's our background, and especially in the midst of a pandemic, we're very heart-filled, compassionate about the work we do. But at the same time, we also made a vow when we became nurses, and that vow was we are not to do harm. And we're not qualified to do some of the things that they're asking us to do. And in the midst of a pandemic, it's not a good time to begin to put us in positions like that and then change the position by the next week to something different.
So I
When
think what,
we try to have the conversation with them and say, look, you know, we're not comfortable. This is what we're used to enforcing laws.
Right.
And we're not used to doing infection control.
Sure.
We're not getting, we just get the answer we get for that is it changes the name of the survey process into something different, but still doing what they want us to do and not
So
what
so
we're trained to do.
so what I'm hearing is that you're saying that the discussions, because you've come together as a classification.
so I was going to say that. I was going to say that basically we brought our issues to the union. Initially, the union told us the state can change your duty statement whenever they want to. But the caveat is they can't change our job specs and they can't change our classification without union approval.
Right.
So
And
we
it's
told our
violating the
union we
law.
did not want them to throw us under the bus in this process. Don't let this be a quick yes or some letter that goes by your desk and you just put your because the vulnerable residents of California are at risk.
Yes.
And the lives of many people are at risk, especially in a pandemic. You don't want to be looser with your grip on enforcement during a time when people are dying and their families, they're dying a lonely death. There's no oversight. Like your daughter, when you think a daughter can walk in, a relative, you kind of give them care that, you don't want the daughter to walk in and they're laying here and soiled or whatever. But when when the family's been locked out,
Right.
it's like when the cat's away, the mice will play. And I'm not throwing every nursing home under the bus. There are some that do a good job. But to answer your question, so we raised those issues with the union. The union then heard us and they asked the state for a meet and confer. And I think we're at about the 6th or 7th meet and confer right now. That's what's taken the duty statement through 4 revisions. That's what's taken the survey process to be renamed 4 times because the union, and in that meet and confer, there are 3 HFEN meeting. There are our bargaining unit chairs meeting, one of the union attorneys is meeting, and on the other side of the table is people from HRB, are the Human Resources Branch, who are advocating for CDPH and the state to push through this plan. And so right now we're at the point where the union has taken our issues to a legal process. So yeah, and so this is where the concerns are being elevated. Like Flo was saying before, and Linda, they were saying that the Nurse Reform Act of 1987, but also the Scope of Practice Act, and also the Board of Registered Nurses is saying that a registered nurse should be speaking to our duties. Just so happened that our deputy director has an English major, is an English major, and
Persuasive. She's a degree in persuasive speaking.
So you're saying what you're looking for, what you're saying is that you don't have like medical people with the medical background that are in part of the decision-making process. Is that what I'm hearing?
And what she's,
Yeah, and we didn't have anybody to begin with that was, we don't have anybody, and we weren't even consulted in the beginning of this when our roles were so dramatically changed, because then we, that's why we formed our own grassroots movement within HFENs, with Ron being, the biggest leader of the grassroots movement, and how we can connect to each other and not only find out that, it wasn't something not only that we didn't feel comfortable with and we weren't doing the duties that we should be doing to protect these people, but it's illegal. And we found the legislative parts of it that say that it's illegal and we shouldn't be doing it. And we're the ones that have pushed it to the union.
Yeah, and that's the part where I think is like inspirational from my perspective, because, obviously as a leader in Local 1000, as vice president for bargaining, again, I understand acutely the power of the collective, the will of the people that do the work. And so to be part of your story, to be aware of it, to know the way that you all have come together in this way, I'm excited from the standpoint of, yes, I would have liked to have been in this fight as an organization for you guys from the beginning, because I realized that there was, this duty statement that was just handed out, and that you guys basically had to say, wait a minute, collectively together. And in doing that, it brought us to this point to where, as an organization, the union has said, you know what, we agree with you, we hear you, and they actually filed the unfair labor practice in August. And
yeah, and we had to push for that. And
absolutely, you did.
You know that. I mean,
Absolutely.
we use not only the power of us as nurses, which is the biggest push, and it was even a small group of nurses within that, that were that passionate that it meant that much to us. And not only that, we pushed until there was a lot of media coverage.
Yes.
And when there was media coverage, that seemed to change a whole lot of things.
Absolutely.
And that was done upon by just a small group of nurses that, were pretty passionate about what we did.
Well, and it goes back to, again, like I said, there's really two areas of focus, at least in my view. And it's, again, there's the legality of it. There's that question, the how, in fact, if there was a good reason to make the changes that they're proposing, the department's proposing, if there was a reason to do this, and now there's still a process that has to be followed. And so there is a legal aspect to that, and you guys have done a great job of sort of pointing that out. And kind of, now I'm thankful that you've engaged, the union, and so that the resources, our legal people can wrap their heads around what it is actually that the department is proposing, and the legality associated with that, and the liability. The other side of it is, again, the health and safety aspect, And
real quick, Tony. So you have to realize, obviously, that the state's under financial constraints. So from the department's point of view, they're trying to reduce the numbers of COVID deaths. And they're thinking by what they're doing is going to facilitate that. I think in the long run, it's going to have the opposite effect. And then my last point is, I think you have to remember too, that a lot of nurses feel like they're in jeopardy of being labeled insubordinate.
of course.
So, we have issues like that going on too, where people can't take a stand necessarily because of the ramifications of being labeled insubordinate.
Right. Well, and that kind of goes back to that collective, and that's the part that is so powerful, is the fact that, again, as a classification, as a group, that you all have come together so that you bring light to the issue, and then that, reduces the ability for anyone to be targeted in any specific way, because you have, the union behind you, they're engaged in this fight with you. And at this point, I would say that really they're looking for the response from PERB, because that unfair labor practice has been filed. So there's no, go ahead, Ron.
Tony, that what Flo was saying, I think it was Flo that said when we were in nursing school, we took this Hippocratical oath. Mm-hmm. They tried to use that oath. If you all remember when the pandemic first hit, they used that oath against us to say, "Oh, you all took an oath to do this."
That we cannot say no to the assignment. Yeah.
And the state's own training material,
right? You remember that?
tells us we're not consultants. The training federal material says we're not consultants. Everything that they tell us from day one is that you are not a consultant.
Right. Right. So
right. And one of our colleagues who teaches in the academy is stresses that's the first thing we teach you in Academy 101. You don't give advice, because if I walk in and say, oh, cool, you know, why don't you house the residents like this, or hey, do this and pull these over here and do, you know, and then they have deaths in that place. Then they're going to say, well, that surveyor Brian told me, you know, to put the patients there, and that's how they got, you know, it's just a liability. So yeah, we took a Hippocratic oath, but we don't want to put, we don't want to, for one, jeopardize. And let's keep the focus on, it's not just about us not wanting to do, so it's about vulnerable residents in California that are at risk during a pandemic. I think the number, you know, the numbers in California, and we're on our way to another surge, or what have you. And so, yeah, this is why it's important to, and I think even the state, even though we're in this kind of this battle, I thank the state for at least taking the time to hear us so we can talk about these things, because, you know, it could be, the situation could be worse, and it could be where they're not listening to you at all.
Right.
And they're just going on, but they are, you know, and the union calls it an interactive process. Matter of fact, that's when the union filed the unfair labor practice, when the state failed to, you know, remain at the table to conduct, you know, as long as we're talking and working it out, that's part of the RAFC Deals Act. The Deals Act says that, you know, it talks about the interactive process.
I wanted to make a point in regards to the facility and the facility's responsibility to provide infection control consultants. If there's one thing that I've seen as a surveyor in the skilled nursing facilities, there's one common denominator to a lot of what we end up citing, and that is lack of staffing. So the facility would go ahead and get a till of money from Medicare. And from that till of money, they're supposed to divide it out amongst what the residents' needs are within the facility. That may consist of physical therapy, occupational therapy, or other things, one of which having enough CNAs, certified nursing assistants, in the facility. So one of the things that we tend to cite a lot of is lack of staffing, such as responsible for falls, inadequate staffing in the kitchen. CNAs have been found in the kitchen. There's no dietary certificates in the kitchen. Weight loss occurs because of this. So there are amputations that occur in these facilities because they haven't supplied enough staffing to turn the residents. The residents end up getting an ulcer on their leg, and then they need to have an amputation because of that. So staffing is the web that weaves throughout all of these problems in the facility. And most of the times it's because the corporations are not supplying adequate qualified staff in the facility to staff these. This has also gone into the director of nursing and also the administrator. I'm going into these facilities now, and they're changing every 3 months. It's a new DON. It's a new administrator. Then you start to see the DON at another facility that she was at. So now it's not only through the facility itself with the certified nursing assistants and the nurses, but it has reached a point to the administrators and the director of nurses. So this added attempt to try to bring in the surveyor as adjunct staffing to be the person who's going to be the educator. And at one point in time, they tried to make us be responsible for these places in case the DON had issues and they had an outbreak, then we were supposed to take it over. So,
that's true.
As you can see, this would create huge problems as far as education. Did we have adequate training to do this? This is not just, we're in an emergency, go do anything you can. This is not how this is supposed to be handled. So in bringing in the adequate, as Pinky was talking about, her role is HAI, but on the facility level, and she's on CDPH's level, but on the facility level, the facility is responsible to fill these roles, to be the infection consultants, to be the people that are going to come in service their staff on donning and doffing PPE. They're to come in, they're to do the training, they're to spot check their employees to find out if they're breaking technique, if they're not taking off their PPE appropriately, or they're not putting it on appropriately, or they're moving from a red zone, which is COVID positive, to a yellow zone, okay? And they are supposed to have people within the facility 24/7 to be checking these things. So again, we go back to staffing and staffing these facilities enough so that the residents in the facilities maintain their safety. So my point in bringing this up was that the infection control role that they wanted us to play is really the corporations and the facilities' job to recruit and bring in their own infection control consultants, so that frees us up to be in a non-conflict of interest in an unethical position, to be taken out of an unethical position, and to be brought in to fulfill the role as enforcers. So it's not okay that the facilities can just not staff adequately. We've all seen it. It goes through every process within the facility. Everything that we cite, we can, somewhere along the line, we can find it wasn't because of adequate staffing. And this is just another example of that, by trying to bring in the surveyor to go ahead and meet the needs of the revolving door of the administrator and also the director of nursing. And this is not our job. Our job is to be on the outside, looking in, providing an extra set of eyes and say, this is where the safety risks are. This is what needs to be corrected. There's a loophole here. We can see numerous residents this is affecting. This needs to be addressed. So our incestual enmeshment with the system is a problem, and it needs to stop, and it needs to not be occurring. The roles need to be clearly delineated.
Thank you for that. That's very well stated. You know, when I think about all the families, I think about all the families that are, you know, that are counting on you guys. Almost, I mean, everybody that we know has somebody that's in one of these facilities. And again, as you guys have pointed out, you're the last line of defense, so to speak, because the restrictions on being able to go into these places. This is the last, you know, place that anybody would want to go, because again, you're restricted. We know that there's COVID cases, active COVID cases. So we're literally asking you all to be the eyes and the ears for, you know, our family members, our loved ones who might be in those situations that, you know, they can't speak for themselves, which, you know.
Also, I want to say, Tony, for the staff that work there, because I can say that we all probably can say that these are very extremely hard-working people. The certified nurses assistants, the nurses that work there, you talk about front line. They've been pushed to the limit in these places, and they get the worst rap of anyone. There's never a media coverage that talks about all the hard work that they do, and it's a backbreaking hard job for the nurses in these facilities. And we do helps them too. What we do helps to be their oversight to make sure the corporations do what they're supposed to do, like Flo said, to make sure they have staffing, to make sure that they have the equipment, the PPE that they need. I mean, we're their enforcer too.
That's fantastic. I mean, again, like I said, I feel like I speak for a lot of people, because again, you're unsung to some degree. And as a state worker, I know that other state workers, even if they never really thought about it before, you know, the fact that, you know, we're going to be able to share this, I'm excited, because again, I sense the pride. I sense the pride in what you all do. Every time I've ever run into anyone that is actually in this field as a health facility evaluator nurse, that's one of the things that comes out like immediately, is that there's a sense of pride and responsibility. And again, it's unsung, but it's really, I really appreciate it. The fact that, you all are willing to take the risks that you're asked to do to go into these places and to do the work that you all do. Also, the idea that you bonded together in terms of, the department trying to impose these changes. You all came together in a way that I think sets an example for, all of us as state workers, because a lot of people don't understand the value of the union and what the point is. And again, because of your persistence, because you reached out to the union and said, here are the conditions, here's the proposal, and here's the problems with that. And you've been, just explained it beautifully tonight, of what, if there was no resistance, what would have happened. And it's brought us to this point in time where we now have, the union saying, we agree with you. We have our legal people, our legal team saying, let's look at this. Let's look at what's being brought. But you all did that collectively together, to the point to where the union said, you know what, okay, we have to look at this and we have to see, is there validity to what our folks are saying, these state workers, these RNs, is it valid what they're saying, their concerns? And they agreed with you. And they agreed with you to the point that, they went through the meet and confer process, ongoing, I should say, with the state to try to come up with something that makes sense for these times right now, in the midst of the worst health crisis that this country has ever seen. And, the fact that the union said we're going to file an unfair labor practice is, I don't want to, you can't emphasize what a fantastic achievement that is for you all, because you're the drivers behind it. You all are the drivers behind it. And, I think it's definitely something that other state workers need to take note of, that, that is the power of the union, is that people come together for a reason, to, for a common goal. So with that being said.
And Tony, I just wanted, before we end, just to shout out to the media and those that have kept the story alive.
Absolutely.
And also shout out to the California Advocates for Nursing Home Reform, which is an acronym for CANR.
Yes.
It's because they put out the Adopt a Sniff story,
right.
That we were educated as to what was going on.
Yes.
And so we want to shout out to those people and to all our fellow HFEN that were not on this video. We speak for all of you and appreciate our colleagues to the utmost.
Absolutely, absolutely, and we have to also bring some light to the folks that you reached out to initially and that you've been working with, in terms of the bargaining unit chair and the attorney that's been assigned to kind of to work alongside of her.
And the HFEN that are in the room.
And the HFENs who have been part of the meet and confer process, because again, this is supposed to be an all hands on deck type situation. It's critical. And again, I appreciate you guys taking the time to come out and to share with folks, other state workers, to come out and share your story, because it's really inspirational and it really does show the power of the collective, the people coming together, because that's ultimately what a union really is. It's not, a building, it's the people, right? So thank you all. We're going to stay on top of this. We'll be coming back to you for an update. Like I said, right now, again, we're at a place where we know now that the union is active and engaged in this fight, and that's due to your persistence. Keep up the great work. Thank you for everything that you all do, and we'll see you down the road. Thank you so much.
I just want to say a shout out to you, Tony, and say
Tony,
thank you very much for all your hard work and your attention in this matter. It's really been appreciated. Thank you.
yes.
You're welcome.
And congratulations on your announcement that you're running for president.
Thank you. Thank you very much.
SEIU. So
And
congratulations.
thank you for all the help you've done with
Go,
us.
Tony.
Thank you,
And
guys.
so, Hussein, we thank you too.
Yes, thank you,
Our
Hussein.
technical.
Yes.
Good job.
Thank you.
And for all of you that is my first time seeing, no, second time seeing your face, and first time, it's good to see you. Yes.
Yes. Shout out to everybody. Thank you.
Awesome.
Bye,
Awesome.
Good night.
Thank you, guys. Can't wait to do it again. Thank you so much. All right, everybody be good.